showing up for the next session of smallholder pig medicine for veterinarians. And this evening's excitement is approach to the sick pig or the pig herd. And building off of last week's normal pig, I think you'll find some slides fairly similar or familiar as we go through this. And there's actually a fair bit of information tonight. So I'm just going to kind of motor on through. If anybody feels the need as a sort of a group think that you need a break, let me know. Otherwise, we're just going to carry on because I think there might be more questions with tonight's presentation, just because there's a lot of information here. So the process, just gonna, sorry, get this out of my way here, hide this, there we go. So the process of investigating, or working up a pig problem or a pig herd problem, obviously always starts with the phone call. So it's really important, to chat with these people, even if you're not quite sure or you haven't really got a huge comfort level yet with pig medicine. A good history will always lead you to the path of righteousness. So ask a lot of questions or never too many questions, get a feel for what's going on if you're unfamiliar with the client. I'm really embracing the technology in the sense of it's great when people send me photos or videos and say, hey, this is what's going on. And really helps a lot because in your head maybe you're forming a picture, but when the picture is actually there in front of you and it's the accurate picture instead of maybe the inaccurate one in your head, it really does help you to go forward. And obviously then you plan the farm visit depending on whether it's an emergency or you can sort of make it in a more timely fashion, and do your review. And we're going to go through all these in more detail as we go through the slides. And then I have this thing that's telling me people are coming into the room. It's driving me crazy. There we are. So then after you've done the visit, you can call the client, ask for an update, whatever. Maybe the results are in, you can talk about the diagnostics, treatment, prevention, and, set up some strategies. Maybe they want to have you come back on a more regular basis. You can plan future preventative care, sit down with them and find out what their wants and needs are after you've repaired the problem. And then not only are the owners happy, but the pigs are happy and you are too. So, when you get that phone call, and note age of phone, which dates age of vet giving this lecture, um, so when I talked about getting the history, you've got to think about, what kind of questions you're asking. Is it an emergency? Do you need to go out there? Are they having pigs that are struggling and coughing and they've got obvious signs of pneumonia? Then maybe that's just a little bit more of an emergency than, hey, we've got some pretty itchy pigs, and maybe you're just dealing with, mange or lice. So what category does that complaint fall into? What systems do you think are affected? You're getting an idea of differential diagnostics. Again, you've got some photos you're looking at, and then it gets you thinking about, after I've talked to them and I'm kind of getting my list, are there samples I need to take? How am I going to confirm this diagnosis? What might be helpful, and any other considerations? As I said last week, ogres have layers and onions have layers, and we need to look at swine production as a sort of a layering event, that there's many things that influence the expression of disease. It's really is a population approach. It's public health for pigs. So we have to assess parameters that not only influence the health of the individual pig, but the health of the entire herd of pigs. So you're peeling through the layers. You're looking at groups, and then you're whittling your way down to the individual. And as I said last week, and this is the very same slide, environment and management will often be the biggest disease influencers. And if they're not there at the level that's adequate for the pig, that might, you might just see disease being provoked by insufficient environment or disease management. So firstly, do not go right to the individual pig. I think that's all sort of like what what we're sort of trained with here, we're doing individual animal medicine, whether it be large or small. But when you're going into this farm, first of all, you want to be biosecure. You don't want to take anything out there more than they've already got. So if you've been to a pig farm, that you have plastic boots. You have clean boots, or you put your plastic boots over your shoes. You've got coveralls, that sort of thing, and everything is clean. You're sort of not the end of the day person with a lot of gunk, as I used to be as a young vet. You'd sort of be crusty with dried stuff all over you, and that doesn't make a great first impression either. So be biosecure. Don't bring anything out that they don't need to have. And observe. And I'm going to have some photos as we go through this too, because it really helps. And so you're walking to the barns. Some of them are sort of more homemade, kind of very creative kind of smallholder farming. Some are really tidy and very neat and tidy, and some are they need a little bit of help. But getting a feeling for what you're getting into, what you're seeing as you're approaching the barn, observe that environment. Then you're looking at those groups of pigs. Then again, there's different classes of pigs, depending on the kind of smallholder you have, whether we have farrow to finish, where we have farrow to wean, are they just growing up pigs for their own meat? So you're looking at the group, and then finally you're going to drill down and look at the pigs in question that you're called out for. This is really a busy slide, and you've got the PDF document as well, and so you can sort of develop your own consultative sheet if you want, and you can put these questions on that will really help to lead you to getting more answers that will help you to get to the right diagnosis if it's a disease problem, or find out what sort of management issues there are that maybe are defective, or there's feed issues or whatever. So what breed and species we talked about, the white commercial pigs, which are more refined and have different requirements than our hardier heritage breeds. What ages of pigs are affected? I mean, pig diseases tend to fall kind of nicely into the different categories of pigs. We have neonatal, we have, the nursery pigs, grow finish pigs, we have the sows. So, very frequently you'll find that the problem is restricted to a certain class of pigs on the farm, which kind of helps in its management. How big is the pig? Are the pig? How many pigs are in the group? What's going on there? Are there other species on the farm? So if you're looking at, birds on the farm, they have chickens, they have ostriches, they have emus, they have whatever. It depends on what kind of a farm you're on. Are the pigs exposed to these? And why am I saying avian? Because we're thinking avian influenza, and we talked about this last week, where the pig certainly is called the mixing vessel for different influenzas, human and avian, and mixes with their own flu viruses, and you can get a new type of virus coming out. So you need to know if there's any interaction with other species on the farm. I mean, really, what we really need to know as well is how long has this been going on, how many are dead or how many are sick, and then you're, like I said, you're evaluating the shelter and pasture. So like I said, there's a lot of stuff coming at you, but it's really not that hard. Just develop your own little check sheet, have it in categories, organize it as makes sense to you. And I think you're going to be really happy with having something like this, because it's really going to help you get the feel for being a swine vet. And then, it's, as I said earlier, you're not just looking at that one or two pigs that are affected. Back up a little bit, look at the whole group. Is it just only one in that group that's affected? Are there three or four? Is it the entire group that affected? How are the pigs in the neighboring pens? What's happened lately on the farm? Any changes to the feed or water or pasture? Did new animals come in? Any visitors to the farm? You've got to find out the basics. If they're commercial white pigs, and it's a piglet issue, you want to make sure that their management's there. Also, receiving iron if they're in the barn only and not having access to soil. We talked about that last week. The vaccinations, sort of what's routine, what's being fed, and any other people sick. And there's been a few times in my career where you go into the barn and the pigs are all coughing up a lung and everybody's sick, and you're like, this pretty much sounds like swine influenza. And then you say to them, so anybody have flu and ate recently? Anybody been sick? And probably 20% of the time I'll hear, yeah, yeah, somebody got sick and they stayed home, but they were already shedding the virus, and we suspect that they spread it to the pigs. So you have to work through all those aspects as you're trying to figure out what exactly is going on. And then these are sort of the categories of your differential diagnoses. I actually think, when you even just taking this course, I sort of hope that it provokes you into thinking more about the questions you should be asking, even if, when you're working on an individual animal basis. I really think that swine medicine expands your mind, and it gives you a different look at the kind of questions you should be asking. And once you've done swine medicine, it's just so automatic that you're looking at everything, and you often will come up with an answer you need to get, if you're working with a species, just because you're sort of retraining yourself, if you will, to step back and ask those questions. Um, by the way, I had to laugh. I have to tell this story. I was watching um, TikTok or something today, and it was a marvelous piece of diagnosis by the pet owner, and it reminded me of sort of being a pig vet in a way. But at any rate, she was missing one of her ear pods, and she was playing some kind of 70s rock band that I really liked. And so she only had the one pod, and the cat's looking at her. So she puts it in its container and shuts it. Of course, it shuts off the one pod, and you can still hear music playing from the cat's belly, which I thought was hilarious. Whether it was real or Memorex, I'm not sure, but it was pretty hilarious, and I thought it was an excellent step in diagnostic workup. So work through it, figure it out, and you won't always get to where you want to go on the first visit, depending on what's happening and the size of the operation and how specialized it is. It's sometimes has taken me, and I have photos of this later on, 3 or 4 visits before I finally got it all figured out. But it does show your level of interest and that you really want to work with the client. I did mention vaccines. It's really is kind of important to know the vaccination status, because it can rule out a lot of disease issues if they've vaccinated appropriately, that you can sort of put lower on your list of things to worry about. So, you're walking up to, you're in the barn, you're looking at animals, and these are like real life photos that I have taken in the last couple of years. I tend not to be really good at taking photos in my own practice. I have to do more of this. All right, the pigs on the left, and this, you could possibly walk into a smallholder finishing operation. They've got, maybe they bought 50 pigs, and they have like sort of a mini farm. They're making, they're going to send all these off to market, and suddenly there's a mass death experience. And if they've got a nice little barn that's over a pit, we can have hydrogen sulfide gas, which is extremely toxic. A little bubble of it comes up, and suddenly you have a bunch of dead pigs. I doubt you're going to see this in smallholder, but it's just sort of an example of, I'm looking at these pigs, and they're all in good condition. They're, some of them are a little bit reddish here and there, but there's a math test experience, and usually the history is it's springtime or fall. We were agitating the manure before we spread it, and we went in the barn, and there were a bunch of dead pigs, and you could pretty much guarantee you had hydrogen sulfide gas experience. Pig on the right, this is actually a boar that was in an isolation barn. I work with a very large boar stud, and you really don't need to know a whole lot, except those things on the back are about 10 times the size they're supposed to be, and both of them were really huge. And this case actually really got me lit, because I actually thought I was dealing with foreign animal disease briefly, because of the genetic value of these animals. We had a number of them dead. We sent them off to the University of Guelph to do the postmortems. I was extremely unwilling to do them myself. I wanted everything checked out, and as it turned out to be a bacterial infection that I didn't know, and it actually made for a great case study to my colleagues, that caused bilateral testicular enlargement from infection. It was Glasserella suis. So you don't need to know it's Glasserella suis, but you do need to know that this pig doesn't look like he's having a really good day, and you need to, then you can focus on that. Observations. So we saw, 2 big crash and burns in the earlier slide. I could have reversed these, but it's always wakes everybody up when you see the weird stuff. What do I see here? On the left, wow, a nice, bright, shiny barn. Look at these pigs. They're pink and they're curious and they're looking at me, and the feeders are clean, and so you get a feeling for, sort of the attitude of the producer towards his animals, that this is a nice little operation. Obviously, this is a bigger one. This is quite a large barn. I think it held about 1,000 pigs. Doesn't matter. You get a feeling for, how they're running the operation. And there's not a lot of environmental challenges here. On the right, we get a nice little heritage sow nursing her piglets. What am I seeing here? Probably feed wastage. That's a lot of corn lying around. And they do have a feeder. You can't see it. It's just away from the out of the photograph there. And maybe the staff was thinking, we should use this as bedding, because you can see there's a little piglet lying down there. So you could work on this one and say, well, we should keep the feed in the feeder, and maybe we should look at getting a source of straw or shavings, probably more appropriate. This was a summertime photograph, but it gets you on the path for making sure that you've got the right environment coming into fall and winter. So you need to sort of know your pig vitals, and you know it depends. These are sort of a generalized pig vitals. Potbelly pigs will have certainly faster heart rates than a finishing pig, for example. And besides, I think the only thing you're really going to be able to evaluate is the temperature. If you stand back, you might be able to count the breaths, but it's kind of hard to look up and down at your watch and the pig at the same time. You're sure not going to hear the heart, because that if you're trying to restrain that pig so you can listen to it, all you're going to hear is screaming at the decibels in your stethoscope at about 120 decibels. So it's just more for academic interest as far as the pulse and respiration. Temperature for sure, it's important. So we saw those pigs lying dead in a heap there. They looked good, right? They were in good condition. They were sort of reddish, on the belly, maybe on the face, but there wasn't anything on that pig on the exterior that would, make you wonder about a disease process. And those are the tricky ones. When the pigs look okay on the outside, it's really is challenging. The other pig that I showed you with the enlarged testicles, okay, now I can start to focus on that. And then obviously, we had postmortem done, and that revealed an awful lot of fibrin and clearly a bacterial infection, which really made me happy, because I was thinking about a foreign animal virus that's only seen in Mexico that causes this. So this is how my days go sometimes. um, so you're looking at the pig. Are they wasting? And we'll look at photographs of that. Are they wasting away? Are they losing muscle mass? Are they hairy? Pigs tend to get hairy when they're not feeling well, or it's really cold. It doesn't mean they're not feeling well if they're hairy, but it can reflect on sort of the environmental conditions. When a pig is feeling challenged, especially if it's lost some muscle mass, they will get a little hairier just to try and hold in a little bit of body heat, as weird as it sounds. So you can get these sort of shaggy looking creatures, not quite like the Mangalitsa, but they can still get shaggier. Is there anything on the, abscesses on the animal? Are they thumping? So thumping just means they're breathing really hard, and they do almost like pump. You can just see that pig with its expiration just trying to push it out. So that certainly is a great indication of you've got some kind of mnemonic process. Are they gant? So you look at the belly, is it filled out, or tucked up and tucked in behind the ribs? Just sort of, what do you think of the pigs? What's going on here? Great photograph. What was this? This is PERS. These are PERS pigs, but they could also, these are viral pigs, basically. I can't look at that pig in real life and tell you, oh, that's a PERS pig, because I just had an explosion of circovirus this fall, and they can look somewhat similar. Don't worry about the viruses I'm telling you. You can look them up afterwards. But we're looking at are some pigs look good. So look at the top left pigs. There are some good pigs. There's pigs with their spine showing. There's something cooking in here. Their eyes maybe are a little blackened. I often look at that. Pig in the bottom right or bottom left, yeah, they're pretty emaciated. There is something going on. And so circovirus itself will cause a chronic wasting in late nursery and grower pigs. So, that kind of pops up on my list of things to worry about. on these pigs, especially when there's a number of them. It's an individual pig, it could be an individual problem, but when there's a group of them starting to waste, you've got probably something infectious going on. These may be harder to appreciate. These are deceased grower pigs, but if you look at their eyelids, both upper and lower, are remarkably swollen. The ear tips certainly are frazzled and shaggy. That was because when after they were dead, the other guys sort of started thinking they were chew toys. Um, so the ears are kind of chewed up. The eyes are really swollen. These pigs, if I could show you the whole pig, would be in really good condition. They were acute deaths in the grower phase. This is a condition I hadn't seen in a long time. It's actually post-weaning E. coli that doesn't cause diarrhea. It causes a neurologic process because these E. coli produce a Shiga toxin. It's called edema disease. And why is it called edema disease? Because you get sort of edema around the eyelids. If you were to cut them open and got lucky, you would see some mesenteric edema, large bowel, that sort of thing. But really tricky to diagnose as far as proving it. And we won't get into the details of it. You can look it up. But I've had 2 of these in the last 25 years, so it's not that common, but it's out there. This is the same pigs before they were manifesting the clinical signs of sudden death. And if you really look at these pigs, I'm looking at these guys and I'm like, wow, they don't look bad. There's a little bit of ear tip necrosis, which we see the little black bits on their ears there. Look on the left wall. There's a pig that's not in great shape. He's kind of leaning against the wall like he's just super tired, not feeling good, just really doesn't want to be bothered. Probably the pig behind him isn't that happy either. And sort of I cut off the picture, which is too bad, but there's 2 pigs on the right. You can just see their heads, and they were similar, not in really good flesh and just starting to feel crappy. And within 2 or 3 weeks, those pigs would be deceased, suddenly gone. You can see there's a variety of sizes here. This is a really good producer. So you can see there's a variety of sizes in this pen as well. So something's really bothering them and holding them back. So last week we looked at normal behaviors to look at. And then, so this week, obviously, we're focusing on looking at what's cueing us in, what kind of behaviors are these pigs manifesting that I need to, that will help me to decide what I'm doing. And so, you can just read through the chart. Don't memorize it. I think the best thing you can do is get an appreciation for what's normal, and then what's not normal will fall into place. How to pigs are lying down all the time. They don't want to rise up, or they're piled up, or they're shivering. They're clearly either it's environmental, or they're running a fever and they're not feeling well. Are they panting a lot, or are they just coughing, which sort of fell under vocalizing, but I would probably should have put that in under respiration. What kind of cough do they have? A deep honking cough, a raspy cough. That actually kind of cues me into what kind of a mnemonic condition I might be looking at. How do their poops look? Are they normal poops? Are they sloppy poops? Do they have blood? Do they have mucus in them? You know, that's going to maybe cue you into, I think we got a diarrhea, and that could be why these animals losing weight. Um, you know, so all kinds of things. And obviously, if they're that ill, they're really not going to be eating that well. So the producer is also going to be telling you that that's also an issue. And also, obviously, looking at the supply of water. Is there adequate supply of water? Because we need that for them. So at this point, if it's an individual pig problem, if he's raising 5 pigs, he or she is raising 5 pigs, and it's a smaller pigs affected, you could probably pick 1 or 2 up, take their temperatures of the affected pigs. As I said last week, I wouldn't be using the hog snare to restrain a pig for examination. It really stresses them out. And you don't want to do that with a sick pig, especially. So you want to use a pig board and kind of squish them against the side of the fence and kind of box them in a little bit, so you can sort of like grab the tail and get your thermometer in there and get a feeling for what's going on. Or he's also got a sort of a pig crate back there, a holding device. Might be a weigh scale. So if you can get them into something like that, if they happen to have that on site, that also makes your life a lot easier for the examination of the animal. So then you have to decide, after everything I just said, which I'm sure I just threw it all at you, what am I going to take? What am I going to do? How am I going to figure out what's going on? So, we're going to go through we're going to go through this, and but there's lots, that you can take, but you also don't really want to overtest. Remember, if there's small holders and everybody's been losing money in the last year, which they have been in the hog world, the prices have been dreadful. There's no money to be made. Don't spend $1,000 in diagnostics. Make sure that you are judicious, and so you'll probably, if there's something that's deceased, you'll animals losing 1 out of 20. That's a lot of money that's they're out. So unlike the larger farms where I might select 2 or 3 representative animals, euthanize them, and do an autopsy, that's probably not going to be a good option on these farms unless it's really is, where your back is against the wall, and we're like, we really got to figure this out. So we'll go through the different tests that you can do that are going to help you out. But you're trying to, get this to an organ system basically, which is really going to help you. So in the meantime, before we get to the individual diseases, so blood is frequently taken on pigs. You can use the marginal ear vein, probably more so in potbelly pigs and pet pigs than because it's one of the few veins that are sort of there to access. I prefer jugular venipuncture myself on larger pigs, but I've been doing it forever, and I find it easier. But you can restrain the pig. Now, if you're going to sample ear veins, you're probably going to have to snare this pig in order to be able to, the little tourniquet at the base of the ear, and raise that ear up and get some blood out of there. Smaller pigs, I do. People can hold them just like this, and we can use either just a needle and syringe. I prefer the vacutainer needle and the tube. I find it much easier, especially if I have to drive around a little bit and find that jugular vein. Sort of note the positioning where they're going in. It's fairly close to the point of the shoulder in that jugular groove, and you can't really appreciate it here, but when you are taking blood from pigs, sort of direct the needle a little bit more towards the opposite shoulder, and you usually have pretty good success. It's fairly big. I mean, once you've done a few of them, it's not that hard. Larger pigs, like as I said, you can snare, and then I've just outlined the areas where I put the needle and tube in place to collect the blood. I usually stand to the side of the pig. I don't usually go in the front of it. It's just where I prefer to be. Um, and if you're, wanting to get some practice at this, you can um, try, on some producers that may have a number of pigs you can try and do this on, or even, spend a bit of time. The odd time I'll have somebody come out and I'll just show them how to blood test pigs. And years ago, a very kind vet showed me how to blood test pigs. So it's a good technique to learn, but so much easier. Somebody in the States who did research at Iowa State or somewhere said, hey, we can use cotton ropes and collect oral fluids. And that just changed my world. And now I don't have so many blood tests I have to do because, quite frankly, your knees burn out after a while if you're doing large groups of pigs. So we can use oral fluids or saliva. It's brilliant. I love this for testing various viral infectious organisms via PCR. You can use it for disease surveillance in a herd. It's not so hot for influenza, but we can use nasal swabbing for that. So what the hey. Have to use cotton ropes. So if you are interested in this technique, you've got some guys with a few pigs, and you might want to figure out if if they've been exposed to PRRS, or you can even look for circovirus levels or whatever you're doing. Cotton ropes, you can buy them on Amazon.ca, and they're called cotton macrame ropes, and they probably charge you more than they're worth. But at any rate, they're usually braided like a 3-way braid or a 3-way wrap, and I take off a length of it, maybe 3-4 feet, and you can just hang them. You leave them for about 30 minutes. Sometimes I'm not that patient, but about 30 minutes, and then you can squeeze out the saliva. You put it in a Ziploc bag, and you put a Ziploc bag at the end and sort of draw it forward, squeeze out it into a tube, and then you just submit this sort of really gross looking fluid to the lab, and they're more than happy to do the testing that you've asked them. So the link down below, it shows you how you go about doing that. So remember, it's got to be cotton. It can't be polyester, can't be hemp. Cotton's your friend, and that'll get the job done. So that's kind of saved me from doing a lot of blood testing work. And think about it, going back to this, you can test large numbers of pigs. So if some of you actually get it to the point where you're doing larger herd work, because you get really excited about pigs like I did, wow, you can test a large number of pigs using this method. You know, you think if there's like 30 pigs per pen on a farm and there's like 10 or 15 or 20 pens in there, just the numbers of pigs you can do with a rope or two per pen. Again, it's sort of a bulk PCR, but it's for surveillance or mostly for surveillance, but also for diagnostic work in the group. If they're really feeling unwell, though, they may be less inclined to chew on the rope, so it's a bit of a trade-off. Feces, yeah, don't put them in rectal sleeves because they tend to want to blow up. Yeah, so use the proper collection tools for feces. Probably in small holders, and especially if they're on the same pasture or the same barn all the time, you know, parasite evaluation is going to be really important. Um, you can check for some viral things. And we'll talk about it as we go along. But mainly, I think parasitism, and you can pool fecal samples. That certainly reduces the cost for the producer as well. So you can test a lot more animals that way. And don't forget to look at the feed. You know, are they making their own feed? Are they doing some kind of a homemade, you know, a home sort of brood feed? Most of them will be buying feed, you know, from the mill. Um, so if they're buying a commercial ration, it's probably going to be balanced. But if they're doing their own home thing, is it a balanced ration? Do they have everything in the specs that you need? And the other thing that I look at as well, especially this year's corn harvest was in Ontario, was fairly heavy for vomitoxin, which, as it says, it causes feed refusal above 1 part per million, and then above 2 part per million, you're starting to get into some type of vomiting um, and poor production, poor growth with this. I think I was hearing, you know, levels of 5, 6 ppm in the corn. So remember also that we're only putting so much corn in the feed, and it becomes diluted down as we add soybeans and premix and whatnot. But still, you can be running, you know, 2 to 3 ppm. So we have what we call toxin binders that can be put in feed. They'll reduce the levels by 0.1, 0.2 ppm, but it's better than a kick in the pants. And so there are ways to manage that, and the feed rep will be able to help you. I mean, they know these things, and so they're good to talk to. Zearalenone, which is an estrogenic mycotoxin, we usually check for that too. Greater than a ppm will start to cause uh, vulvar swelling in young gilts, and you know, you'll have 3-month-old gilts looking like they're in a full-blown heat. It's just from the zearalenone. And of all things, ergot, which is typically a problem with wheat and barley out west, has made its appearance in Ontario a few times. We do get the odd field that will have ergot toxin in it, and remember, ergot causes vascular constriction, and you know, like feet fall off of cattle, and you know, ears fall off, and especially in the wintertime when you have a combination of really cold weather and ergot. That's a bad combination. I have actually seen it twice in swine herds where suddenly the whole herd was lame, and there isn't really a whole lot that's suddenly going to make a whole mature herd go lame. And my instant suspicion was I got something hinky in the feed, and I checked for ergot because I have a bizarre brain that likes trivial pursuit things. Sometimes I don't get the thing that's in front of my face, but I'll figure out something strange. And sure enough, they were putting wheat shorts in their feed from the west, and they were contaminated with ergot. So look at the feed, look at the mycotoxins if you think you have to. Again, you know, you've got to decide what you're targeting, because you don't want to spend too much money doing the testing and sort of bankrupting this poor small producer. Nasal pathogen, you know, some respiratory pathogens can be tested for with just nasal swabs. And then you can get the viral testing swabs from your animal health lab. They are supply them, and you can look for a range of viral, or you can look for bacterial pathogens too. Abortion, sometimes that will certainly be of a concern to smallholders who have a number of pregnant animals. It can be frustrating to diagnose abortions. Um, Yeah, mummified fetuses are probably not great. They're already dried out and long since dead, so they're kind of iffy. You can submit weak neonates or ones that are dead, because they can look for detection like PERS virus and fetal fluids. If you can submit several fetuses, that's really good because it just means more tissues that they can collect. But abortions can be frustrating to work up. So I don't actually often send in a lot of aborted fetuses. I just go for hanging ropes, testing the mature animals, and seeing what pops up there because I'm more likely to find it. And again, where are you going to send them? So know where your diagnostic labs are for um, food animal production. Even pet pigs. When you're sending them away, you'll be sending them to the food animal side because they'll have the pig testing there. So just know where you're going to be sending these samples. So in your post-mortem kit, yeah, which you may or may not use frequently, or you may already have one in hand because you're already doing beef or you're doing dairy or something like that. Just a suggestion of a bunch of things to have on hand. I am queen of Ziploc bags. I love Ziploc bags. I put everything in Ziploc bags. um, you need formalin containers, and I always send in fresh tissues as well, just because I'm hedging all my bets. Especially if you want to do cultures, you need fresh tissues. Formalin isn't going to help you there. um, Exam gloves, tree loppers for cracking ribs, and have everything in your kit. My kit constantly horrifies anybody who's a neatnik because, yeah, there's a lot of stuff in there and it's not necessarily organized. So I wind up having to sort of almost dump it on the ground to find out what I'm looking for. But that's me. I would like to work with myself, and I know how I do best. But have at least this minimum collection of things in your kit, and you'll be set to go for postmortems. So this year I did add, and maybe Doris just make a note of that, uh, a video on how to conduct a swine postmortem. And Josepha DeLay, for those of you who know her here at the Animal Health Lab's fabulous. And she did this for the Ontario Animal Health Network. And so I've put the YouTube link there. It's a 10-minute video. She talks her way through it and demonstrates, how you do the postmortems on a relative medium to small size pig. And it's just a very cool thing. Cars Consulting is mainly a series of photographs. I think Josepha's would be really useful if you want to just sort of brush up on your skills. If you've done pig postmortems, if you haven't, it's good to look at. In fact, I always learn something, so I did watching this video myself. So again, when you're submitting your samples for postmortem, um, what are you going to take? Well, what am I focusing on? Obviously, if they're coughing their brains out and they're puffing and they're thumping, I'm going to be focused on the respiratory system. If they're losing a lot of weight and they're really gant and they're emaciated, I'm going to open them up. And depending what I find, if I don't really see anything, I don't find any fibrin or tags or stuff in there, maybe I'll take some gut samples and a liver and a spleen. Spleens are always good. Kidneys are great if you're looking for circovirus. So you just kind of look at what's there, and focus on that organ system, I guess is what I'm saying. So your other option obviously too is if the lab's close enough and the producer is sufficiently interested, you can have them just take that pig to the lab and have the autopsy done there. And like I said, I've done that a few times where I'm specifically concerned, like for those high value pigs. So I'm just going to go through some common presenting complaints in pigs, and it's really hard to take Diseases of Swine, which is a great reference textbook, and take 12 or 1500 pages and distill it down to about 20 slides. So I sort of went after like what do I normally get asked about, and so you're getting sort of my own view on what I think are the common complaints here. So obviously, number one, respiratory diseases, coughing, thumping, issues going on in these pigs. And with mycoplasma, they're either purchasing pigs in and it's a very common organism in pigs. So they're either purchasing pigs in that are already, the herd is positive for mycoplasma, you know, but usually producers will vaccinate for it, which does minimize clinical signs and lesions. If they're unvaccinated pigs, okay, then your radar goes out. This is one of the things I have to rule out with these coughing pigs. Um, and also, you probably want to find out, were they obtained from a sales barn? Were they out single source pigs? Or did they bring some new pigs in that, might have blended, you know, pigs that were negative with pigs that are positive? And the final thing to find out as well is if they're in the neighborhood, if they're in a pig dense neighborhood, this organism is certainly aerosolized, especially in the kind of wet, damp fall we had in Ontario or cool, damp spring. And this organism will travel, I think, 8 or 9 kilometers, something like that. So we periodically get mycoplasma breaks, and it didn't come from pig to pig contact. It came from floating through the air, which the world learned about with PD or PD, our coronavirus outbreak, our epidemic pandemic of 2019 and onwards, because it also aerosolized. So let's say, you've got a pig that's deceased on farm and you cut him open, and this pig lung would be a mess. I mean, you've got this big, red, ugly looking thing, and it's got fibrin on it. And, there's all kinds of stuff happening here. And it's probably a multi-pathogen problem. So, take fresh tissue, get formalized tissue, you take swabs of that. Pig lungs normally are lovely sort of salmon colored. I think we just showed you there. Normal pig lung, oops, sorry, on the left, should look basically like very, very sort of pinky oranges, and it's spongy. It just feels kind of nice and soft, and this lung here would be like hard. Obviously you can see the hemorrhages on it, so it's full of bad things. You get into lungs like this, and I have long since given up on saying it's this, but I can tell you this is probably viral. And of course, this is interstitial pneumonia, which is a viral pneumonia. Which virus? No idea. Could be circovirus. I don't think this one's a PRRS virus, but it could be influenza, maybe, but the distribution's kind of weird. So I don't know. Just send the log and ask the lab to tell you what you got. But it's something viral here. This is a really, really old disease. I don't see it in commercial farms anymore. I should knock on wood, because I'm, I'll turn around tomorrow and see. Every time somebody says this disease doesn't exist anymore in swine, some pig somewhere lives there to prove us all wrong. So this is atrophic rhinitis. This was a huge issue 40 years ago when I was a young vet, and certainly it causes infection of the cells in the turbinate, and it causes distortion of the nose. There's a pasteurella involved in this, and it produces a toxin that can cause kidney damage and reduce growth of these pigs, and they get this little sort of bulldog face and this twisting of the nose. And so this one's pretty straightforward to diagnose. But there's also a virus that can cause severe sneezing and maybe a little bit of nasal issues. So it's a cytomegalovirus. So you want to, rule that out. It won't look as bad as this, but it's sort of things to think about. So yeah, we when you're looking at respiratory issues, it's one thing to say, okay, I chopped up with these pigs and I'm thinking I've got a mycoplasma, but what's the environment like? I mean, is this barn, you opened it up and like, this cloud of steam came out because it was a Finnish sauna, in the middle of winter? That's bad. Is the air fairly fresh in there? Are they able to sort of have some kind of ventilation that keeps the air relatively fresh and dilutes the organisms and move them out? If that's all good, okay, fine, I can rule that out, and then I'm sort of more drilling down to what are the organisms that could be causing problems. Probably not much nutritional and toxic. I had a few monosin years ago. We won't talk about that. I doubt you're going to see that. Is it a viral condition? Is it a bacterial condition? Is it a multi organism problem? The other one that I do see the odd time, and you'll probably see it more in smallholders, is ascarid infection. And the swine ascarid has a great lifestyle because it starts out in the gut. The eggs hatch and then they burrow through the gut lining and they migrate up through the liver, wind up in the lung. It's a wonderful holiday event, and then they get coughed up, more further maturation process. And if you really want all the details, you can look it up. So, at any rate, note I said they go through the lungs and get coughed up. And if you have heavy ascarid exposure, I've been aware of a couple of barns that actually had pigs dying from a massive sort of histamine release and a lot of edema in the lungs, and that just from this pressure of ascarid migration, larval migration through the lungs. So it is possible to have that. Certainly, taking samples, fecal samples, probably not a bad idea in a smallholder because that can complicate, a bacterial or a viral or a mycoplasma pneumonia. So again, I just built a bunch of onion layers for you. I know I'm talking a lot here, but I'm just kind of, getting you to think about, um, you know, all the different aspects that influence this in a pig. So how do we manage this? I got these sick pigs. Okay, is the environment correct? I don't have a finished sauna in there. Is it, the temperature kind of comfortable for these pigs? Most of these barns are going to be colder in the wintertime, especially what we've all been through. So they may be a little bit shut up more. Can they get a little bit more airflow in there? But saying that, do the pigs have access to some kind of bedding where they can burrow and keep warm? Is there a sick pen? If there's a proportion of these pigs that are sick, we need to move them over to a pen, because what happens with a sick pig? It's uncompetitive. It won't get to the feeder in time before some bigger pig beats it out of the way and snatches all the food away. So sick pigs need sick pens, not just for able to observe them and treat them, but so that they can compete fairly with each other to eat the food. Um, Viral infections, we have to decide what it is. Antibiotics are really only given for secondary infections. Anti-inflammatories might help, like ketoprofen or, flunixin or something like that, Metacam. Can we vaccinate against this particular agent? Bacterial, again, judicious use of antibiotics, maybe dealing with secondaries. Can we vaccinate? And then obviously a deworming program if there's a parasitic component kind of piled on top of all that. Neonatal diarrhea, that's for sure, for sure, for sure, for sure. You're going to run into this somewhere along the road. They can be really frustrating because they can be multi-agent diarrheas. Probably in smallholders, more frequently in the winter, fall, winter, spring, and the cooler weather, because the environment may not be entirely appropriate for the baby pigs who really don't thermoregulate for a couple, 3, 4 days. They need warmth. They need a covered creep area. We talked about that last week. They need a burrow and shavings, whatever they've got. If they're just sort of lying out there like that heritage sow with her babies, going to guarantee they're going to chill. And I should put that slide in here. Note to self. So what happens with neonatal diarrheas is, and if it's related to chilling, is the gut um, motility slows down, and then you get overgrowth of especially E. coli's, and then this leads to the diarrheic process. And from the diarrhea, they're also they're dehydrating, so they're losing water, they're losing potassium, and it can actually lead to seizures in pigs that are dehydrating and losing everything they've got. And so you might be thinking, oh, I've got a neurologic problem, but look at its bum, or look at the pen of the farron crate, and make sure that you don't have a diarrheic problem going on. So as you can see, there's a number of agents. I would say probably the E. coli's are the most common. Frequently, these sows aren't vaccinated pre-farrowing, and till you get there to do your good job. And so it's much easier to prevent E. coli than to try and work with it. Coccidiosis is pretty common in piglets. It's so where E. coli is earlier on in life, coccidiosis kind of shows up around the 8, 10, 12-day range. Different viruses. Rotaviruses is pretty busy right now out there. There is a combo vaccine for rotavirus A and E. coli. B and C are, B is a human strain, which now pigs are exhibiting, and C is out there. So it gets a bit messier with that. So basically, it's good sanitation, reducing the environmental challenge. These piglets aren't being exposed to it, making sure they get colostrum and they're warm enough and those good things. Um, we don't see circovirus in nursing piglets. Sapovirus is fairly new, but I'm not going to get into that because I'm going to just totally make your head hurt if I keep going on about it. So management of these are usually judicious use of antibiotics, making sure the environment's appropriate for them. And we'll talk about electrolytes in a minute, but certainly electrolytes help a whole lot, much as in calf diarrhea. They certainly do help in piglet diarrheas as well. You may see vomiting and diarrhea anywhere from baby piglets all the way up to adult animals. If you've got sows with vomiting and diarrhea, we do have porcine epidemic diarrhea, which is a coronavirus, and it's making the rounds this winter in Ontario again. So we'd really like to know that we have it or we don't have it. In a smallholder herd, it'll blow through. You'll get over it pretty quick, but it does cause about 100% mortality for 2 to 3 weeks. So depending on how many sows they have, if they only have 1 or 2 farrowing every month or two, you'll be through it in no time, but they will lose entire litters no matter what you do. So pretty nasty stuff. And there really isn't a preventative vaccine. It's basically natural exposure, and then you're probably pretty sturdily protected for 2 to 3 years afterwards. Um, so some E. coli infections in baby pigs can cause vomiting. In bigger pigs, grower finished pigs, we're looking at more commonly the brachyspiras and more diarrhea. I wouldn't say there's vomiting with that, or Lawsonia, which is ileitis. So again, take judicious samples. Brachyspira and Lawsonia, you don't have to do a postmortem. If they're not dead, you just grab some poop and then you look at your submission form. They can do a multiplex PCR for Brachyspira. You can do a PCR for Lawsonia. They'll help you interpret the results, and then you can target vaccines and or antibiotic management to get over that. Environmental management, cleaning, disinfecting, that sort of thing. So there's lots you can do, but you need to know the name of the guy before you even get started. So that's why a good diagnosis is really important. So talked about, I'm a little out of order here. Talked about diarrhea in little pigs, developing that rough hair coat, getting dehydrated, taking fecal samples is probably the easiest to do. Rule out which you're really not going to see salmonella in baby pigs. So it's going to be some kind of E. coli, or maybe it's going to be a rotavirus. And again, there's the days of age where you're seeing that. Really, what's the most important besides environment and vaccination is that colostrum. That first milk is huge. So make sure they get that first milk. You can provide electrolytes and water to treat the dehydration in the piglets. Calf electrolytes are great. They're commercially made. I've used that many times in the past. Some people will give them starch products. There's potato starch available at the feed mills. You sprinkle it on the ground. It's kind of a drying agent, but also helps to limit the exposure of other piglets to the issue and dry up these pigs a little bit. As I said, farrowing areas should be washed and disinfected after you've gone through the problem. But you can be a weekend hero, because when all of these pigs are all going to get diarrhea when it's like Saturday at 5 o'clock and the feed stores have closed and you haven't got any calf electrolytes on hand. So this is taken from the World Health Organization. And this is a homemade electrolyte solution. It's actually made for kids that have diarrhea and that they can't access WHO. They actually make electrolyte packets that are distributed at different centers. And so, failing that, you can build your own sort of homemade electrolyte solution. There's the recipe right there. Carry it around with you, and you will be a weekend hero. It doesn't have everything you need in electrolytes, but it sure gets you through a bad spot. And the other thing to remember is, do not give these piglets cold water. I mean, really, I just told you, cold gut stasis, E. coli overgrowth. Make sure it's given in warm water. It's going to help these guys recover faster. I just threw this in here. I put this today. This is the ingredients in commercial replacement electrolytes. So you got glucose, sodium, glycine, and these are to promote the, oh gosh, you're getting me into the exchanges of, you know, ions, and you need glucose to power it, or glycine or something, and I can't remember anymore. Replacing bicarb, potassium chloride, both which are lost with diarrhea. So it's a much more elegant solution than the homemade one, but the homemade one will get you through a bad spot, like I said, if you need to build something at that time. Neurologic diseases, yeah, you're probably going to see this if you're a smallholder vet, and probably one of the biggest issues I would say is mm, somebody forgot to turn the water on, or they're not getting enough water, or it's a really hot day, or whatever. So you want to make sure you don't have any deficiency of water supply, because pigs don't do that well. One of my worst cases, and I talk about it probably in the potbelly pig session, I think, but where somebody had gone, this couple had gone away and left their pig in the garage, and the neighbor was supposed to take care of it and forgot to, or whatever happened. But this poor thing was waterless for 5 days, and when they came back, it was head pressing and blind and circling. And so pigs don't do water deprivation really well. After about 48 to 72 hours, you might see something. Now, I just went through a case in a barn where the solenoid failed on the pump, and we weren't getting water. Now we do have larger barns often have water meters, so you can tell what they're taking in, which is really cool. But saying all that, it's kind of a cool story, because these pigs actually managed to go 5 days and we didn't lose anybody. But if you've had water deprivation and you have some pigs with neurologic signs, you get a good history of it, don't just turn on the taps and give them full access to water, because their brains dehydrate, and it's essentially those poor little dehydrated cells will explode because you got an osmotic effect now, and then they'll just succumb anyway. It's small amounts frequently, and probably even supplying it as an electrolyte solution might not be a bad idea, because a little less of an osmotic effect. So rule out water. Make sure you got water flow, and and most producers, that will be not a problem. It'll be working. So if I got neurologic signs, I got 6-week-old pigs staggering around. Frequently, strep suis is the problem. Used your history of big weather swings will often bring it on, especially in these little barns. Um, like I said, I talked about edema disease. I don't do enough smallholders to say I've never seen it there. Maybe it'll happen, but I don't really think so. Brucella suis, forget that. We're not going to see that. Rabies, that's always a possibility. And there's a history of, there was a fox in the hen house, or a fox came into the barn, or a skunk was in there. And sometimes they don't think to tell you this because they're not really thinking about it, but often the doors for these smallholder barns are open and things wander in and out. So why wouldn't, a rabid raccoon or whatever it is go in there either? One of my first cases of rabies was not in pigs. When I was a young vet, it was in cattle, and here I was, like, ramming my hand down this cow's throat who was unable to swallow properly, and I was trying to give her some bolus of something, and I had her on IV fluids, and they were like, yeah, we had a fox in the barn like 3 or 4 days ago, and it went up the middle of the feed alley. And it's like, would have been good to know before I jammed my hand down her throat. So there was a round of rabies vaccine for yours truly. So don't ever assume that, there wasn't a bat or something in the barn. And, if they have strange, sort of clinical signs, more like a dumb rabies. I don't think I've ever seen rabies in a pig. Now I'm going to, because I just said that. But make sure that you have a history of everything, and then you'll know what you're dealing with. Abortions, we talked about that. Anywhere from sort of dried up mummified pigs to just, late gestation. Then it's amazing how fast they mature in those last 2 weeks of gestation, which is, remember, 3 weeks, 3 months, 3 days. Um, and it's frustrating to work up reproductive problems. with abortion. So it may be something as simple as bullying sows. You get a bunch of sows together, and they decide to pick on somebody, and she gets knocked off her feet and knocked off her feet often enough, she may decide that it's not worth carrying the litter, and she may lose it. If sows are super cold, like in weather like we've just had, and the environment isn't quite up to speed, um, they may abort their litters. And I have seen this over the years in old barns because reproduction is an option. So if it's a matter of you need all that energy you're taking in to stay warm versus I got to feed my kids and stay warm, but it may cost me my life. The body says reproduction is an option. We're getting rid of the kids, and we're going to make sure you take care of number one first. So keep that in mind. Really cold weather, um, can provoke abortions. Other reproductive problems, you may hear like, well, the sows aren't getting bred, you're not getting pregnant, and then you sort of look at the guy that's in the other pen over there, and it just may be the boar is starting to shoot blanks, especially if they only have one boar there. So that would trigger me to think maybe that is could be a problem. Nutritional causes, if they're all thin sows in there, um, they're not maybe feeding appropriate levels, there's not a feeder space or whatever's going on. um, Again, reproduction is an option. They'll decide not to get pregnant in order to stay alive. If they're not vaccinating their sows, there's a possibility that parvovirus leptospirosis, especially lepto on indoor outdoor pigs where they can access contaminated urine, that sort of thing, standing water, puddles, because remember, pigs turn pastures into moonscapes, which then will collect water. Um, so there's lots of things to think about. Working up reproductive problems, I would actually say to you, is probably more challenging um, in a smallholder situation than a commercial herd, because we've got environment, vaccination, everything else taken care of. So your work is really cut out for you with that. Um, Lameness, oh boy, maybe less of a problem in smallholders as opposed to reproductive, because they're outside and they're using their limbs, they're moving around, so they're probably sturdier in the long run than the commercial pigs that don't have that access. But you can get you know overgrown hooves, and more of a genetic issue, I think, than it's something somebody's doing wrong. So you get the odd animal with what we call a slipper foot, long curly toes, and that's going to be causing them grief and moving, and actually will contribute to reproductive insufficiencies as well. Diet balanced, make sure that they have enough vitamin D and vitamin C. um, I don't really think there can be micro cracks in the hooves, and you can get bacteria getting in through there, and a lot of sows in large commercial farms, that seems to be the problem, and they're called for lameness because it's internal, like a laminitis kind of thing. One thing you want to rule out. Again, I don't think you'll see it in a smallholder, but Seneca Valley virus, and I'll show you some photos of that, which can cause coronary band lesions, blisters, and on the nose. And it's not a foreign animal disease, but it will light you up if you ever find it, guaranteed. So, lameness probably tend to be more injury related, I would say, overall in smallholders. Maybe structural, but not shouldn't be a really huge problem. Skin lesions, and you'll probably be called out possibly for that. If they're not on a balanced diet and they're short on zinc, you'll have like really crusty, bad looking skin. Sarcoptic mange, still see lice occasionally, believe it or not. So you want to make sure that there's no parasitic issues on those pigs, because that can really cause a lot of discomfort in there. Skin lesions, erysipelas, diamond skin lesions. I'm going to show you some photos of those. Um, Swine pox. So there's a bunch of stuff. It's skin lesions. So it's where it really is a problem would be in grow or nursing piglets to nursery piglets. So we hear that you've probably heard of greasy pig disease. It's a dermatitis and epidermitis, and it really starts behind their ears. It's a normal skin flora or flora, staph hiacus, and due to wounds and scrapping and whatever, you get sort of spreading fulminating infection that goes back on the skin of the pig, and the skin cracks, and you get leakage of serum and things, and then they get hairy because they're cold, and they just they look like poop. They really look like poop. You get a film of grease sort of over top, which is why it's called greasy pig disease. um, and of course with this hairiness, and then serum leaking, the bacteria is just having a heyday. Can be frustrating to work with. Mainly occurs in litters from gilts. If you're going to have an outbreak of greasy pig disease on a commercial farm, usually associated with a large proportion of gilt litters being born. um, I tend not to culture it. I mean, you just look at these things and you go, yep, that's a greasy pig. So how do I treat it? That's a problem because they're in these small barns. So in the summertime, you're okay. You can keep them warm enough. But if you're going to treat them with foaming agents to lift ends, I love using Prevail on these pigs, accelerated peroxide, because it bacteria don't like it, and it's not an antibiotic. You're just really sort of gently disinfecting the skin, but you've got to do it like 2 or 3 days in a row. I find antibiotic injections useless. First of all, because a lot of these are multi-resistant bacteria, and secondly, because it just doesn't tend to work. Hydration's useful, getting those electrolytes out, because remember, they're losing um, fluids through their skin, so there's some dehydration going on. Some people will use sort of a mastitis ointment mixed in oil and kind of spray it on. That tends to help. It's slow healing, but with smallholders, they want to save everything. So I think, you know, um, go for it. I mean, a lot of these pigs surprisingly survive. They're just going to be slower growing. Evaluate, what's going on. Is it gilt litters? In which case, everybody goes through it the first round, and then your next litters will be fine. They'll have appropriate cholesterol antibodies to pass to the piglets. We might suggest doing teeth trimming, which is on neonatal pigs. When they're born, within a day or two, we'll just trim the tips off of the teeth, just so they don't slash each other. They can be pretty sharp, so you might want to look at, maybe we can do that. Again, hygiene is really important for management of greasy pig. That's just ugly. But some of them surprisingly survive. A couple other kind of curious things. They look similar. What looks similar, but what isn't the same? Swine pox. I've seen a few cases of that over the last couple of years, and they sort of roundish kind of lesions on the pig, um, you know, spread across the body. I've seen it in sows, not just growing pigs, and it's a pox virus. It just goes away. So that everybody gets exposed, and away it goes. The one on the right sort of looks like the one on the left, except it looks more advanced. And this is actually circovirus, which is the virus we talked about with the wasting disease. Some pigs will get porcine dermatitis and nephropathy. You get a vasculitis, and you get some poor pig that looks like this and usually succumbs. And that should flag you to, let's check this out for circovirus. Are they being vaccinated? And if not, I can prevent this in the future because we do have a vaccine. Pityriasis, which this is sort of the head of the pig is to the left, the back of the pig is to the right, and it's sort of this expanding looks kind of fungally infection, and have no idea what it is, and it spreads on the pig, and you might think it's greasy pig, but it always starts on the belly and goes forward as opposed to behind the ear backwards, and it doesn't respond to anything and goes away on its own. So that's always kind of satisfying, although it does gross people out to see it. So we're moving along nicely here. So I'm going to tell you a little bit of a story on working things up. How do we figure things out? Client of mine, this is now a number of years ago. So you're going into a barn and you see this, and you're immediately not happy because you're seeing spines and ribs. And if you sort of look up to the back, there's a little red pig that really is unhappy. He's actually kind of got Dumbo the elephant ears are folded back against him. His left elbow may be infected. He's got a hunchback. He's got big issues. But these pigs are not doing well. And whoops, sorry. So I've got pigs being weaned and the mortality is climbing up to 10%. And I know that normal is 2 to 4% post weaning. And this is a larger herd, but it still can be a smallholder too. Pigs aren't growing, they're losing weight. And what frequently happens is people think it's going to get better, and often pig diseases are waxing and waning, and they think, okay, tomorrow's going to be a better day, and sometimes tomorrow is a better day, so they don't call you. And then when you realize you're deep into the middle of it, you're going to get they're deep in the middle of it, they're going to give you a phone call. So I got mortality climbing, pigs losing weight. I'm thinking, okay, maybe I've got a PRRS virus because that really strikes the nursery hard. It can, but usually I see pneumonia in pigs and thumping, and we're not seeing this. Maybe it's circle virus that causes wasting, but the pigs are all vaccinated, and I shouldn't have this many affected pigs. It's a really good vaccine. So, oh, I don't know. So I do a bunch of postmortems, and they're amazingly unrevealing, which is pretty classic. That's always happens in vet medicine, right? So we're working through this, and I've gone back 3 or 4 times to this herd, and I am not getting. I'm taking blood. I'm doing fecal samples. I'm more postmortems, and the producer finally decides to, before one of the visits, he's you know looking at his feed consumption costs because these pigs are taking forever to go to market. They're not growing well, but his finishing feed costs are really up. And ironically, the nursery costs are down. Now that could be happening because they're not eating properly. So yeah, I mean, it's going to cost me more to finish a pig if it's eating slower and taking a lot more time. So long term, he's eating more feed. It's just taking him a lot longer to do it. But they look so crappy in the nursery; they're not eating properly. Okay, that makes sense. And the finishing pigs were not eating well in the finishing barn, and they're also starting to get really hyperactive, and they're starting to kill each other. Pigs are good at that. But something really annoys them, sometimes they'll just take it out on each other and kill each other. So we finally get down to looking at the feed, and hindsight's always 2020. I really thought, looking at these pigs, that I was dealing with an infectious disease. These pigs were on complete feed, which meant it's all made at the mill. It comes in pellets. So I just assumed everything is good. Well, when we looked at the nursery feed and we had it checked, and you can do a calcium phosphorus protein, is a pretty easy sampling you could do, send it to the lab. The nursery feed was at 14% protein, which should have been at least 18%, and the finishing pigs were on 22% protein and should have been 14%. And then, if things weren't bad enough, our days to market increased to about 225, and some pigs actually got rickets. So our protein was reversed, and they're not eating well, and now they're getting deficiencies, and they're looking at their costochondral junctions were swelling. We didn't really see them because, of course, these pigs were finishing and going to market, so it's sort of hidden by the layer of fat and muscle over the pig. But the plant called me and said, "We think we need to instigate a welfare infection. We think this guy is actually breaking the ribs of his pigs with a shovel when he's loading them." It's like, who would do this? Because they're all swollen. Well, they're swollen because they had rickets, which prompted me to do a feed investigation, and we had a calcium phosphorus imbalance because somehow and these things happen. You've got big bins where feed's delivered to, marked 1, 2, and 3, and the guy doing the deliveries had decided he was going to do 3, 2, and 1. So he put feed 3 in bin 1, which would have been the nursery pig feed, but he was putting finishing pig feed in there. So do you know how often this happens? A pile. So always look at the feed. It's an easy fix. And so once we realized what was going on, we also got out a welfare investigation, which I had the lab results to say our calcium phosphate levels are way low, and in our piglets, they need very high levels because they're just putting on so much bone mass at that point. So we got it sorted out. The moral of the story was, and for anybody that's maybe going and doing somewhat larger herds, these are jars with weekly. They were making their own feed on farm here, but anyway, they had these jars, and they would put a sample of each week's pig feed, whether it was sow feed or grower feed or whatever, and stack it on the wall. And then as they, every so often they would empty out the older jars and then fill them with newer ones. And so this is kind of a cool story because I've been telling my producers now forever to keep at least 6 weeks worth of feed, put it in a Ziploc bag, my favorite, put a label on it, sow feed, nursing feed, whatever. And this, again, this is for larger farms. Stick it in your freezer. That way, if you think you have a feed issue, you can pull back. You can go back 6 weeks ago and you can have that feed analyzed, because once it's all fed out, you can't reach back. So it's harder to look at mycotoxins or imbalances or whatever if you're not keeping feed samples. This came from South Africa. So I was there in a gig years ago, and toured through, and their sows are, it's South Africa, so they're open fronted living. They're, look at that, we have loose housing in South Africa many moons ago when I was there. And they always, this farm kept samples and could reach back and do testing if they had to. So it was extremely a very cool experience. Learning from that, and I've applied that ever since in practice. Sort of switching gears a little bit quickly, we should talk about zoonoses. You want to wash your hands after you've been there, and don't eat your sandwich with, filthy fingers. This tends to be the habit of veterinarians who work in large animal, and I'm not saying anything about me being one of them. But some organisms like strep suis, lepto, salmonellas for sure. I had a colleague who years ago had a farm, and it was a larger farm, that they broke with salmonella, and I think a 4-year-old in the house got it. Now they survived it, but it's not pleasant when it passes on to people. So keeping kids out of the barn if you're diagnosing something going on these smallholder operations, just till you can get it cleaned up, is a good idea. Influenza A, like I said, we can give it to the pigs. They can give it back to us. Giardia, we all know that can go to people. Toxoplasmosis, sarcoptic mange, although we're not a primary host, the pig is, especially in pet pigs, when people like to hold them and they didn't realize they purchased a pig with sarcoptic mange, and they'll actually burrow around your belly area. And I used to have physicians call me once in a blue moon and say, "Oh my gosh, I've got this client, they've got a pig and I think they've got sarcoptic mange." And I went, yeah, you probably do, and you'll need to treat it and it'll go away because they're not the primary host and they don't tend to multiply on people at all. So, and dermatophytes, ringworm occasionally. So just be hygienic, like carrying around a bottle of disinfectant or disinfectant wipes and things. I think we're better with that now, certainly with after COVID. I was not as hot before with it, and I will readily admit that. So you just don't want to bring anything back yourself. Okay, so back to the stuff that we really worry about, that you don't like to get these calls for acute mortalities and high mortalities. So certainly temperature extremes, this really cold weather has been awful for all classes of livestock, not just swine, but everybody. Frozen water and problems with that, or too hot, pigs don't sweat. So if it's too hot and we can't cool them off, some of them will die from heat stress. We talked about nutritional errors, unlikely to be, I got a, pig creep or nursery feed delivered to my finishing pigs. That's not going to kill them. But what will kill them is if you got beef pellets delivered to pigs and it's got monensin in it, rumensin, that's cardiotoxic to swine. And so I have had a few cases where they opened the wrong bin on the truck and emptied the wrong feed, and we had a mass mortality. And so that's why history is important and good postmortem is important, but just talking to people, because often that is very revealing. PED virus, epidemic diarrhea, that's high mortality in piglets. PRRS and circovirus, not so much. It's more of it's a longer term to death, so I wouldn't call it acute. Parasites are unlikely unless, like as I said earlier, with high burden, environmental burden of roundworms, ascarids, you might get a mass mortality. But that was like a one-off. So get a good history, and never feel ashamed to reach out to people to help you kind of work your way through it, because we're all glad to assist. Finally, mass mortality on a smallholder farm. it's probably going to be the common things are common and the rare things are rare. But in the back of everybody's mind, a lot of information out there on African swine fever, different foreign animal diseases, foot and mouth disease. We do have, Seneca Valley virus that pops up once in a while on commercial farms, and it has blisters on the nose and on the coronary band. You can't rule that out, that it's not foot and mouth. You can't assume it's, just a Seneca Valley virus. So that's, where you're on the phone on the farm to CFIA and saying, got something happening here. I think you better come out and rule it out. And on a smallholder, it's not so bad. I mean, just tell them not to ship any pigs and they'll do their diagnostics, and they're pretty good. Usually within 48 hours, you don't have a foreign animal disease and you think it's Seneca Valley, and then you'll manage your way through that. Reporting here, reproductive problems in sows, kind of ignore that. What I'm thinking about here is, severe abortion storms and sick pigs all over and whatnot. And so if you have like a multifaceted problem going on and a history of somebody coming back from overseas travel and fed the animals sausages or something, we had leftovers, which are really not supposed to be. We talked about that last week, but get that history, because it may be really important to know that, yeah, I've got to rule out a foreign animal disease. So just, quickly, there's a list of them. You can certainly look these up. There's have a foreign animal disease chat. I maybe can squeeze that in next week. It's pretty busy too, but these are just sort of things we need to think about. And certainly with the advent of the iPhone, we can look these things up pretty quickly and look at pictures online. So you can be just as clever as anybody else. This is just sort of a simpler chart. Certainly acute lameness. Acute lameness is the clue. Reluctance to move, blisters. You better be calling somebody. Neurologic signs across the board and everything. I'd be talking to somebody about that. Pseudorabies is still circulating in feral swine in the States, although it's not a commercial swine. Classical swine fever, again, I don't think you're gonna run into a foreign animal disease, but if it's just pretty weird, reach out to somebody and talk. There's just a slide on African swine fever. So it's basically it's severe hemorrhages, hyperemia. In acute outbreaks, you can have very high mortalities, but there's different levels of virulence of viruses, and so the ones that we're all none of us really want to see are that sneaky one that creeps in, and you get some sick pigs in a corner, but everybody else looks good, and you don't think much about it, and then one day you wake up and realize that we've got something going on, and it's African swine fever. The other really good organ to select, you're doing a post-mortem, and if you see a great big blackened spleen, we used to get it occasionally in circle virus outbreaks too. You best be taking samples of that, and you best be, worried, especially if it's kind of got big black bumpy parts on it. Might want to give somebody a phone call as well with the appropriate history behind that. So, we all worry about being that vet that misses that foreign animal disease. And depending on how you look at it, I think biosecurity is pretty tight on big commercial farms, but it could be people with smallholder pigs, and they've gone off to the old country and to see the grandparents and smuggled stuff back in the suitcase, which happens regularly, and then the pigs get hold of it and away we go. So that's why we think likely it's going to happen. So again, if you see vesicles, this is Seneca Valley. Couldn't tell you it's not foot and mouth, so you need to call CFIA and discuss this. So know who your local district office is, have their phone number somewhere, and then there's the 1-877 or 866 numbers, after hour numbers, for a variety of different concerns for CFIA. But they're pretty good at getting back to you. So anyhow, there we go. We are bang on. I'm sorry I didn't give anybody a break today, but a lot of stuff here, and we're just sort of touching the surface. But I think, as I said, for smallholder diagnostics, just get a really good history and never be afraid to reach out if you're not sure which direction you're going in or what you're thinking of. There's lots of good people out there between the pathology labs, the vet colleges, and the swine practitioners. We're glad to help out.
Well, thanks, Dr. Sue. As usual, that was just a wonderful, wonderful presentation. Thank you so much for that.
Thank you.
So I don't know if you've been able to follow the chat. That would take spectacular multitasking, I guess. But there are a couple of questions there, and if it's okay, I'll
Okay.
maybe just read the first
Sure.
one,
Okay.
which is: do you have the I think they mean, do we here in Canada have the equivalent of foreign animal disease diagnosticians in Canada?
That would be CFIA. And that would be actually the lab, the level 4 labs where these samples would go to. We get training for it as swine veterinarians. I know several people have taken the foreign animal disease course out in Winnipeg, and this was a long time ago. I don't know if CFIA still offers it. But you certainly, there's always updates, or I know there's another ASF something or other happening shortly, and I keep signing up for them and just kind of reviewing them because I keep forgetting. And in fact, I had to look up ASF today and was looking at the, how it's spread in Africa, and through a soft tick, and there's a sylvatic cycle there. But saying all that, it's just good to review it periodically. So there aren't like diagnosticians. I mean, they're in the labs for sure, but not out in the field. We're not sort of looking for this every day. It's just when something smacks you, is this is really weird, especially the blisters. I think Seneca Valley virus would be one that would really get you excited with smallholders. But certainly it'll only raise your blood pressure till you find out what it is, and then you can relax again. Did I answer the question? Was that okay?
Sounded good to me. I don't know if the person who asked it has any follow-up, but just working down the list here, I will tell you, if you haven't had a chance to have a look, you got to compliment the idea of saving 6 weeks of feed samples in jars. Got very big reviews from your audience, so that was way to go. Yeah. Okay, there is a comment that from Doris, actually, that next week Krista Arsenault will be talking a bit about CanSpot ASF, and so a little more about specifically about ASF. Moving down. Okay. You'll enjoy reading the chat. You got a bunch of compliments here, Susan.
Oh, thank you so much. Yeah. I always think I'm bombarding everybody. I should really look at this while you're going through the diagnosticians. Yeah, feed jars, that was just so cool. Travel when you're traveling, go see if you can go get a tour of some pig farms. I mean, it's not easy because a lot of them are biosecure, but I learned so much going to other countries and doing some pig stuff, or going to conferences where there's a pig part or something, and interacting with people. It's just amazing. Oh, there it is. CFI still offers a FAD course. February 13th, March 31st. Nope, not going there myself. Bad time of year. Winnipeg, sorry.
We won't judge. That's okay.
Yeah, so I think, I wouldn't lose sleep over it in a sense, but I regularly review these. And certainly any of the veterinary colleges, like the ones with a large swine component, like Iowa State, University of Minnesota, go to their websites. They've got a nice compilation of foreign animal diseases there that you can look at. And I did a course for, was it last year, the year before, for the golly, which organization was in Ontario? Okay, it's gone from my head. It's a blank moment. At any rate, there is one. I can send it off to Doris. If you want to just have the slide deck, it's fine, and you can look at it. It's about an hour long too. But at any rate, there's a lot of different places you can go. So don't feel like you're sort of living in a vacuum. Any of the large universities have some really good information there on these foreign animal diseases.
If I may, I had one question myself. I'll maybe slide it if that's okay. So when you're talking about diseases of neonatal pigs, and as someone who used to raise pigs, and so like way more familiar, as much as I'm familiar with commercial pigs, pretty common that sows won't necessarily be physically equipped to raise the entire litter, particularly the more prolific ones, right? Like they will have some teats that are the guys on those do very well, and some teats are not so good, hence the expression, blah blah blah. And so is that something that and so as a producer, I would spend a certain amount of time putzing around, cross fostering if one mom had a bunch of babies, but she just physically couldn't raise them all. Is that something that you see in smallholder, or are the genetics different and maybe that's not as much of a problem? Just thinking if the owners too were rookies, they might confuse just kind of a poor mother with a disease problem, perhaps. But
Yeah, and certainly, if you've got a sow, and they often tend to keep their sows into advanced ages, so you'll get
right,
some atrophy of parts of the mammary gland. That's a really good point. So they may have 10 or 12 nice little piggies and nowhere to go. So that becomes a problem. Smallholder, if you truly are small, and the other sow has long since finished taking care of her kids, and now you're into maybe bottle feeding babies, you can actually raise piglets on milk replacer. It's just a lot of work,
right,
but it's doable. So that's for sure. If you've got enough sows and you've got a couple that farrowed at the same time, one's got 8, never works out that way, but one's got 8 and one's got 14. You could try and even up the litters to make sure that everybody got access to milk and could go along like that. But yeah, certainly, yeah. If they're not getting enough milk and they're hungry, that's not helping the cause at all.
yeah. Not seeing any more in the chat. If I may, just one final question from me. I'm
Sure.
drunk with power here, right? But so when you're talking about here's where you do want to phone people, and so just to recap on the repro diseases, it start thinking about phoning people in a more serious situation if you see say abortions plus something else. Is that correct? Like abortions plus a bunch of sick sows or sick younger guys or
Well, yeah, I
um
think if the whole herd is sick, um, that's where I would get concerned, and with a
gotcha.
history of travel in there somewhere
Right.
too. You know what I mean? I've
Yeah.
never run into that, but I think just because I haven't doesn't mean, and especially if there's people, there's more smallholders now. Sort of, I think COVID really propelled a lot of people into wanting to get into more backyard chickens, backyard pigs, kind of
Yep.
thing. So it's a possibility that I wouldn't want to rule out. And so like classical swine fever or pseudo or classical swine fever for sure. They're just really sick. African swine fever. They're just really really sick. Everybody's sick. Everybody's horribly sick. And I'd rather say I'm not sure what I got here. I need to talk to somebody, as opposed to I think we can work through it with a pile of antibiotics. Um,
Right.
I'm not saying that that's what people would do, but when it's pigs tend to have diseases for the most part focused on class of pig, right? So here's our E. coli's in the young pigs, and here's our ileitis in the older pigs, and our sows, might get some roundworms and cough a bit, or might get some, like, I don't know, lameness. So
Right.
we can sort of sort it out. But when everybody's kind of doing the same thing, that's where my radar goes out, and I'm like, I don't think of too many things that's going to hit everybody all at once
Gotcha.
you know, other than feed, maybe environment, or maybe something hinky that just came into the herd.
Okay. So watch out for something hanky then. Okay.
Always be looking over your shoulder. Yes.
Okay. Words to live by. Um, okay. I don't know that there's anything else in the chat, and so I'm wondering if you, Dr. Sue or Doris, anything else we needed to cover? Okay.
Nothing on my end. Thanks, Barb.
Yeah, great. Well, again, Dr. Sue, thank you so much. It was just a wonderful, wonderful presentation. Really,
Oh, my pleasure. Thank you.
lots of information, very entertainingly related. So thanks very much for that, and thank you all of us for joining us. And once again, this was recorded. There will be a recorded version will be made available as soon as we can, and we'll email you folks with the links when it's ready. And so please join us next Tuesday, same time, same place, same Zoom link for the next session of this wonderful course.
Okay. See you then.
Okay. Thank you, folks.
Thank you.
Bye.
Bye, everyone.